Hello, everybody. My name is Tasha Penny, and I'm a program manager at the Registered Nurses Association of Ontario. And I'm going to take the next 20 minutes or so to go over how to frame your idea and focus your learning within the ACPF program. Before I begin, I just want to point out that if you have any information regarding ACPF, to please contact Erica D'Souza, who is the project coordinator for this program. So I have done a previous webinar on the ACPF program. So in that webinar, I reviewed the key elements of the fellowship, the eligibility requirements for participation. I briefly reviewed the 4 types of fellowships within ACPF, as well as just briefly what the application is about and our review and selection process. So if you're looking for more information specifically on those 4 things, please watch our archived webinar on the ACPF webpage. So in the next 15 to 20 minutes, I'm going to provide a brief overview again of what ACPF is and the different types of fellowships, but just very briefly. Mainly I'm going to discuss the purpose of the proposal and its 7 sections, and hopefully get you to start thinking about what your learning goal is, and if you have any answers or any questions that you have, again, please contact Erica. Okay, so ACPF is RNAO's fellowship program, which has 3 main benefits. First, it allows for a unique opportunity for registered nurses and nurse practitioners in Ontario to meet a specific learning need with their organization and RNAO support. It fosters a nurse mentoring opportunity because one of the main criteria of ACPF is that the applicant has a mentor that will work with them quite closely. And finally, it helps the applicant's organization improve patient care by way of educational development of the applicant and nursing staff. So this is a 450-hour focused learning experience. So what that means in terms of full-time is 12 weeks full-time. And then part-time, if you're not able to do this full-time, it's about 20 weeks. So, 20 weeks meaning part of the time you are working and then part of the time you are focusing on your fellowship. Again, I just really want to point out that it is the applicant's learning need that should drive the proposal. Of course, it should meet some sort of gap or need within the organization, but it should be the applicant that is really filling out the proposal and identifying what it is that they want to learn. So just a brief recap. We have 4 types of fellowships. So within ACPF, we have 3 skill development streams, and that includes the clinical, leadership, and then best practice guideline implementation streams. And then we have a new fellowship, which is the AMS NAO Fellowship. And within that fellowship, there's 3 core themes, which is self-identity, education, and work environments. So clinical fellowships focus on the direct development of clinical skills, knowledge, and expertise. So applicants interested in this fellowship want to enhance some knowledge and skill that will impact their patient care, the direct patient care they provide. Some examples from past proposals for the clinical stream are provided on this slide and include chronic pain management and a substance-dependent patient population. And then another good example is assessment and management of critically ill term and preterm infants. Now, the leadership stream focuses on the development of skills and expertise that support nursing practice and the profession of nursing as a whole. And in the past webinar, I went over the 4 areas of the leadership stream. I won't in this presentation, but just briefly again. The 4 areas of leadership foci is education, management, research, and policy. So if the applicant is interested in, the leadership stream, they will have to pick one of these leadership foci to focus their learning plan on. And then finally, within ACPF, the last stream is the BPG Implementation Fellowship. So this focuses on increasing capacity for, evidence-based practice and skills and knowledge transfer, uptake of recommendations, and then implementation of RNAO-produced guidelines. So an example that I have here from a past proposal is knowledge transfer strategies for implementation of RNAO's BPG for crisis intervention. So the applicants interested in this type of fellowship will focus on one of RNAO's guidelines that they're wanting to help implement some way in their unit or area of practice. And this stream, along with the clinical fellowship stream, are quite popular. So if you're still in early days and you're not quite sure which skill development stream within ACPF that is right for you, please review our questionnaire called What's My Fellowship Stream, and I've provided the link at the bottom of this slide. It forces you to ask yourself, 4 questions that will help you to then understand what the skill development stream is right for you. Now this brings me to our newest and last fellowship stream, and that's the AMS NAO Fellowship. So NAO has partnered with Associated Medical Services, and they're offering 8 fellowships a year for 3 years. So this fellowship really is similar to ACPF in that it's a self-directed intensive learning experience, aimed at developing knowledge and skills that will impact, patient outcomes. However, the sole focus of the AMS NAO Fellowship is humane, compassion, person-centered care. I've provided the link to the AMS website if you are interested in learning more about this Canadian charitable organization. So as I was saying, this fellowship focuses on either sustaining, enabling, or supporting humane, compassion, person-centered care and nursing practice. So there are 3 core themes within this type of fellowship, and the applicants asked to pick one core theme and weave it into their learning goal. So even though that this has been a very new type of fellowship to RNAO, we have already received proposals, and one great example is providing compassion, client-centered care to patients with dementia in a long-term care facility. So the core themes identified by AMS is self-identity, education, and work environment. And again, the applicants are asked to choose one of these core themes that makes sense in terms of their learning goal. Okay, so let's move into what is the purpose of the proposal. So if you have ever seen it or are interested in downloading it, it might seem quite overwhelming because it's quite a lengthy process, but it's very important because the information that it asks for will help you to have a very successful fellowship. So it's a very comprehensive description of what you're proposing that you're going to do in the fellowship, as well as you're going to outline what your role, your mentor's role, and your sponsor organization's role is in terms of the activities that will be done, who's going to be responsible for what. And it will help RNAO and our external reviewers have a clear understanding of what the fellowship goals, activities, and outcomes are. So again, I've provided the link to our ACPF webpage where you can go and download the proposal. And just so you know, we have 2 proposals. One is specific to the 3 skill development streams in ACPF, and then we have a separate proposal for the AMS NAO stream because it does ask a few different questions. So on this slide, I just wanted to show you what the breakdown of the proposal is. So the proposal has 7 sections, and they each have their own weighted worth. And if you notice there on the bottom, the learning plan is worth the most at 40%. And we do have a webinar, as I believe I mentioned earlier, dedicated just to the learning plan. But what I'm going to highlight right now is the abstract, which, is only worth 3%, but it's in the abstract that you're really going to clearly identify what your learning goal is. So the learning goal describes exactly what it is you want to learn through the fellowship process. And I highlight that word learn because it has to be learning focused. So just 4 things you should keep in mind about your learning goal. Make sure it is consistent with the skill development stream, or if it's the AMS Fellowship, the core theme that you are focusing on. They should link and make sense. Again, the learning goals should be clearly identified, in the abstract, and throughout the rest of your proposal, it should be consistent with, when you're talking about the objectives that you're wanting to meet, the strategies and resources you're going to use, and the outcomes, etc. And again, it should be a learning goal and not a project-based goal. And I do have some examples that I will provide, but again, just want to really rehash that message that it's consistency that is most critical with respect to your learning goal throughout your proposal. So I decided that what I would do is I'd provide you some examples of learning goals that are relevant to the specific streams within ACPF. So these are actually, I've taken these from past proposals. So for the clinical stream, a learning goal could be to increase my clinical knowledge and expertise related to nursing care of the pediatric patient with potential sepsis. So again, you can see how this is very learning focused because it's increasing knowledge and expertise. Within leadership, a good example is to increase my knowledge and understanding regarding the design and development of an educational program for individuals in a hospital setting. So, even though this individual is interested in eventually designing and developing some type of program, the learning goal is around learning how to do that. In terms of the guidelines stream, an example I have here is to increase my knowledge and understanding of frontline nursing leadership, as well as the implementation of recommendations from one of RNAO's HWE guidelines. Again, it would be different if the goal was to implement. That wouldn't be relevant to ACPF, but it is to want to learn how to do so. And then finally, I believe I've shared this example before, but for AMS, the learning goal was to learn how to provide true person and family-centered compassionate care to those living with dementia in a long-term care facility. Okay, so I hope that's these last few slides have helped you to start thinking about your learning goal and understanding how you want to frame it. So if you're at the very early stages of the proposal stage, what I would suggest you do next is to speak with management at your organization to determine if they would even support you undergoing this type of fellowship. If you're not quite sure how to speak about ACPF to senior management, we do have a fact sheet for sponsoring organizations that provides all the information that they'll need to know about ACPF. I would suggest you start doing some research on your fellowship. So if you have a learning goal in mind based on some type of need, either for yourself, but also linked to a type of need within your organization, start looking for the literature or any statistical references that will support your argument for the need for the fellowship. As well, start looking into what are the ethics approval policies at your organization. There is a section in the proposal dedicated specifically around ethics approval, and it's an easy way to lose marks if you haven't looked into it. Start looking for mentors. So again, if you're not sure how to approach a mentor about ACPF, we do have a fact sheet for mentors that provides that information. And if you're still not quite sure or you're struggling finding a mentor, I would suggest that you contact Erica D'Souza because she does have a list of potential mentors that you may be able to tap into. And then, obviously the next step too is to really refine what your learning goal for the fellowship would be before you start downloading the RFP and proposal and filling out the application. So I have provided the link at the bottom of the slide to where you can get these fact sheets for the organization and for your mentors. Okay. So if you are interested in applying, please, I would recommend that you either attend the live webinars or watch our archive webinars on our website. to get all the information that you need to be successful in this program. And then, please include your mentors or senior management at your organization who might be interested in learning more. And on our RNAO website, you can check the events calendar for any upcoming workshops. Thank you.